You have a difficult time with the characterization that this was a suicide.
It wasn't. Jeremy would have never shot himself. Ever. He would not have done that to me and the kids. We were everything to him, and he was everything to us.
Stop right now. Get on the ground. Get on the ground. Get on the ground now.
But he had PTSD. He also had high anxiety. He also had bipolar. He was going to the VA for it. He was seeing a therapist and a psychologist.
911 was like extreme emergency.
Hey, we got a guy over here. He was going nuts at the CenturyLink Center of Bossier.
I don't know what's happening at CenturyLink. Oh, the gun went off. Holy.
When he left, did you have any indication that he might be in a psychiatric crisis or?
None. I would never let him leave. If I thought, there was a problem.
Headquarters 233. Go right. Get on the ground right now.
Channel 11033, Channel 11033 for units at CenturyLink.
What's 20 brag?
Signal 50 for units at 2000 CenturyLink, 2000 CenturyLink, shots fired.
I didn't know what happened between the house and CenturyLink, which is only like a minute drive, minute two.
How hard is it for you still not having those answers?
I don't see us getting answers. Nobody wants to talk. I'll never know what went through his mind or what made him go to CenturyLink. Those are questions I'll never get to answer.
Do you have worries, seeing how your husband passed, that the Bossier City Police Department doesn't have adequate training to deal with people suffering mental illness?
They do not. If you've seen the video, Jeremy was in his boxers. You can tell he had no weapon. You can tell there was something wrong with someone standing outside in their boxers. That's not a normal person. The normal person's not gonna do that. Instead of pulling your gun out on them, try to talk to them. Don't just, come at them like that.
If you will, and this will be the only time I ask you to do this, just look at this camera here and say your name.
Bessie May Do.
How old was Jonathan when you lost him?
He was 34.
Tell me a little bit about him.
He was just a happy person, yeah.
He could go anywhere and make a friend. So it's like wherever he went, he made a friend. He was very caring. He would give you the shirt off his back if you asked for it.
You told me your son had a mental health diagnosis. What did he suffer from?
Schizophrenic bipolar.
Developing this morning, Louisiana State Police continue investigating a deadly officer-involved shooting in Bossier City.
Multiple police sources tell us the man fatally shot was armed with a knife.
Jonathan Jefferson was killed by police after a disturbance Saturday.
Tell me, if you can, a little bit about that day.
It was a number day. We got up, he came in the room, we talked. And I said, Jonathan, I'm gonna go to Stonewall and help one of my friends move, but I'll be back. He said, well, go ahead, Mom, I'm gonna stay here till you come back. And that's the last time I talked to him.
We've got a first-hand account from two people who say they saw what happened from just feet behind the police unit you see there.
He was talking, he was saying something, you could tell he was a little bit animated, maybe, a little excited or whatever. He was not in any way like running toward them. He wasn't aggressive.
So fearing he posed a deadly threat, my sources say the two Bossier cops opened fire, killing Jefferson.
Do you still have questions surrounding the circumstances of Jonathan's death?
We are still going into a discovery phase to get all of that done, but we have reason to believe that the Bossier City Police Department violated multiple policies and procedures as it relates to dealing with a situation like this. We know that law enforcement is supposed to be trained to be able to handle situations where there's a mental episode occurring in individuals. It is unfortunate how in situations like this, the criminalization of mental health, it is not supposed to be a situation where individuals are criminalized based upon having situations that are beyond their control.
Is it a fair criticism then to say it's leadership in police departments that fail to see that their officers, the men and women who wear blue and a badge and a gun, that they don't get the proper training they need to deal with people suffering mental illness?
Absolutely, in some circumstances, not in every circumstance. When I call law enforcement, I expect them to come, right? And so we need law enforcement. There are situations though, however, in America where the leadership in certain departments, where there's a culture that's hardened, that refuses to recognize the humanity in certain human beings, and invariably, in some circumstances, it ends up in a tragic loss, like in the Jonathan Jefferson situation.
When he turned 21 and he was diagnosed with schizophrenia and bipolar, it was just like, he changed, but he still had that caring heart. It's like, when his manic episodes came on, it was like, it was uncontrollable. So we would send him to LSU to get help and everything, but once he calmed down, his medicine got worked out, he was back to being Jonathan, just loving, caring, just being him.
It's been really hard, because I'm used to him being there with me, and I have some sleepless nights. I have to go out somewhere and cry because I don't want my husband or my kids to see me crying.
One of the things I see in my capacity as an attorney who deals with these matters, who deal with civil rights matters, in the unnecessary loss of life, is the pain, that these families go through. There's nothing that can be done to literally replace the life of a loved one.
On April 5th, Tommy McLaughlin died, allegedly while in the custody of Shreveport police. The 44-year-old man's death clouded in mystery ever since.
His sister tells us the family believes there's a cover-up. She says when they viewed his body, McLaughlin had a broken nose and jaw and a fractured skull.
There are now calls for accountability over what exactly happened.
KSLA Chief Investigative Reporter Stacey Cameron has also been digging into the case, now uncovering a nearly 4.5-minute video of the incident.
It does bother me that the police department, with all of its resources, could not find the video when a reporter went out under their own free will and volition and was able to find that information.
And the Caddo Parish District Attorney's Office has said a police investigative file with missing reports, statements, downloads, and other vital information.
When you saw stories like Tommy McLaughlin play out locally, what were the thoughts that went through your mind?
Naturally, you want to help. You want to almost jump in the screen and try to help, because at that point in time, you see someone, they don't necessarily need a police officer. They need a doctor, they need a social worker, they need someone to ask not what's wrong with you, but how can I help you? And that situation went bad real fast, and it shouldn't have gotten to that point But when you have a community where over 35 to 45% of people are dealing with mental issues, and you have a public officer who's not aware of how to deal with that particular person, then it's a problem on top of a problem, and that person's in mental distress, and we don't have anyone that's properly trained to deal with them at the scene. It's going to escalate and turn into more and more problems.
And do you think that our community really understood the degree of this issue until this summer when we saw people die at the hands of police that were in psychiatric emergencies?
I think we're still lacking. I don't think we've caught up to what's truly going on. I think more people are aware, but not enough people are aware. When enough people are not aware, that's going to continue to cause more problems.
You know, something went on that they're not telling us. They had to use force against them, and they not being honest with us. And I feel like it's taking so long because they're trying to cover their tracks up.
They tased him.
It's been a long month without my father. Best father I can ever ask for.
We know this video is hard to watch, and before we brought it to you, we wanted to give Tommy McLaughlin's son the opportunity to view the video.
Yeah, he locking up. They tasing him. It's somebody that came and hit him.
For 4 minutes, Tommy McLaughlin's son sat and watched in tears.
I needed to see that because it answers a lot of questions. But it do hurt, you know, to see that my father had to leave that way.
2.5 months after Tommy McLaughlin Jr. died in SPD custody, this cell phone video is the only video that's been made public, and that only happened because witnesses gave it to KSLA.
And Chief Ben Raymond didn't place any officers on administrative leave until the day KSLA released this cell phone video showing the final moments of McLaughlin's life.
It's sad, it's unjustified, and it's not going to be tolerated. We know that this society is riddled with individuals who have mental health disorders, so it becomes important and incumbent upon law enforcement to engage in training to properly deal with situations like this that do not ultimately result with the termination of life.
Were these tragic deaths foreseeable, considering the mental health crisis we face in this community?
Absolutely, absolutely. In fact, particularly relative to Jonathan Jefferson and Tommy McLaughlin, law enforcement was on notice that these individuals had mental health issues because they had been called before. So it wasn't like these were new people, situations that they had not encountered before, individuals that they did not know, which makes it even more tragic what happened to these two gentlemen.
Brittany, tell me about your Jeremy.
He was loving, caring, huge heart.
What do you miss most about him?
Everything. His smile, his touch, his laugh. I miss the conversations we had. We stuck together. And that piece of me is gone, and I cannot get it back.
Start with breaking news right now.
A bevy of unanswered questions about the officer-involved shooting outside the CenturyLink Center.
Learned that it was a Bossier City police officer who shot a suspect in a carjacking attempt.
The deceased has been identified as 42-year-old Jeremy Fox of Bossier City.
How long ago was your husband diagnosed with his illness?
The bipolar, I'm gonna say a good 5 years. He had about a good 5 years.
And the PTSD?
He had probably about 10, 11. So we were managing it. You know, bipolar, you know, you still have your good days and your bad days. But he knew how to manage it. And that day, I would love to know what happened. Just what happened to my husband.
Exposed City Fire Department.
Hey, this is Exposure 911.
Yeah.
There's been a accident in front of CenturyLink. I know one male, we've had a call that there was one male ejected. This caller said that another male is on drugs and now one's trying to kill himself.
106 to 103.
103.
The suspect's supposed to be headed eastbound, possibly towards the CenturyLink Center. He did try to carjack the victim.
Come on. Don't do it. 106. Stop right now. Get on the ground. Get on the ground. Get on the ground now.
Tell me about the morning that Jeremy passed.
When I woke up, he was already up. He was in a great mood. He went and got McDonald's for us to eat breakfast. We sat down and watched TV. We talked about our day. He was gonna go and visit his dad. And then he was like, okay, I'm gonna leave now. And I was like, all right, see you later. And that was it.
Come on. Headquarters 233. Get on the ground right now.
What happens when a person falls into a psychiatric emergency?
When someone has a psychotic episode, they're unable to really do reality testing. They're misperceiving events outside of. They may be hearing voices, seeing things. They may have delusional thinking, which is a fixed false belief.
These are people who are in crisis.
At crisis.
In essence, a lot of these folks won't be aware of what, in fact, they're doing.
Of course they're not in their right mind. They don't know what they're doing, and they need medical services. They don't need to be in jail. Unfortunately, many of them end up there, but that's not where they need to be.
What's your 20 brag?
Don't know what's happening at CenturyLink. The gun went off. Holy shit.
None of my family believes it. He would not kill himself. He would not have done that to me and the kids. We were everything to him, and he was everything to us.
When you start to learn more about the circumstances of his passing, what goes through your mind?
He was alone. He was by himself. Nobody was there to help him. That's what haunts me still, knowing he died by himself.
Citing possible litigation, the Bossier City and Shreveport Police Departments declined to talk about the Jeremy Fox, Jonathan Jefferson, and Tommy McLaughlin Jr. cases. But when the circumstances surrounding the tragic death of those three men became breaking news, for the first time in a long time, the mental health crisis in our community became front and center. One glaring problem: local police officers and paramedics were getting called daily to deal with people suffering psychiatric emergencies with little to no training in mental illness. The Bossier City Police Department, they declined to cooperate with this film, only saying by email that when it comes to mental illness, every officer hired since 2016 has had verbal de-escalation training, and last year, every member of the force was taught to recognize excited delirium. In Shreveport, however, the police and fire departments took a different path, deciding after the death of Tommy McLaughlin Jr. that something needed to change, and ended up partnering with a company based out of San Antonio, Texas, founded by two former police officers with expertise in mental health, launching an ambitious program aimed at providing every member of the police and fire departments with 40 hours of crisis intervention training. If successful, Shreveport will become the first city in Louisiana where all of its first responders are certified to deal with the mentally ill. Lieutenant, explain to me what crisis intervention training is.
So crisis intervention training it's a 40-hour block of instruction from a group out of San Antonio, Solution Point Plus. So the first part of it is active listening and communication. Then we start to learn about the different types of disorders that are out there and how to tactfully walk your way through that and how to get those situations under control. After that, we start to learn a little bit about ourselves. A huge portion of it is self-care, because officers that go to those types of situations, week after week, year after year, it takes a toll on the police officer and how they deal with that. So we begin to learn about what you experience and how to make yourself better so that you can go back into those situations.
The 40-hour CIT training is not a one-size-fits-all at all. The only thing that's standardized is that it's 40 hours. And so a lot of our training is not just teaching them active listening, effective communication, de-escalation. We also teach them about the basic fundamentals of mental illness. We teach them things about like schizophrenia, bipolar, PTSD. We teach them about suicide. But a big part of our training, and what I believe sets us apart, is there's almost equal emphasis placed on the individual officer. And we teach them about police officer suicide. We teach them about officer wellness. It's a mixture of my partner Jesse and I doing the training for the police portion of this, or the first responder, because we also train the fire departments as well.
How important is the crisis intervention training for police officers in this community?
It's incredibly important. I wish we had more of it. We need more of it. It teaches police about patients with mental illness. It really does, so that they can have an understanding that certain behavior patterns that they see aren't volitional.
We don't have any way to tell right now if that guy damaging property, that guy raising Cain and whatever it is he's doing that's violent, we don't have any way when we first come up on that to say, well, he's not just mad because, his wife ran off. He's got a mental problem. He's not taking his medication, or he doesn't have a way to get to the hospital, or we can't break all that down when the violence is coming at you in your face.
You look at it from the police officer's eyes as I see a person who is troubled, but I don't know how to deal with this troubled person other than to do what I was trained to do, and that's to stop this disturbance.
What risks are posed to a person suffering a psychiatric emergency or mental illness when they come into a contact, have an incident with police? Is there the risk that this can escalate quickly if officers aren't properly trained?
Sure, absolutely there is. There is very big risk because, if a police officer tells somebody to do something and they don't have a good contact with reality, they're psychotic, they may just keep doing what they're doing and ignore the police officer. The police officer then does what they have to do that could get violent, aggressive, there could be harm to them, officer or the patient.
Again, what people really need to understand is it's nanoseconds that things are happening. There is no play, there is no rewind button, there is no timeout in those situations. So officers have to be on their toes, they have to really consider what it is that they're doing, and it's all happening really quick.
There are instances where we have been fought before, guns have been produced or whatever, and there are times we've had to put hands on as a fireman.
Obviously would help our officers in their initial contacts, knowing the signals or the behaviors that will let us know that, hey, that is a mental issue. It's not the intoxicated guy or the guy that's high. Having somebody that could help break that down. And I think even maybe more so importantly, that is that they would be a resource to get help for these people after they come into contact with us.
It's easy to diagnose on the scene of an emergency a kid with a broken arm, a guy who's been shot in his chest, but a mental illness is completely different.
Right, and it kind of mimics a lot of the medical emergencies. Of course, we can see a broken arm, we can see a hole through a chest, or we can see someone stabbed or something, foreign object sticking out of a body. However, you have interview skills that you need to learn to be able to find out, is this normal for this person? And especially with mental illness, is this mental illness? Is it a substance abuse issue? Is it developmental delays? You have no idea, and you're trying to figure this out as you do interviews. So communication is huge when it comes to mental health patients. They pick up on a lot, and I'm talking about not just verbal, the nonverbal also. They're looking at how you're standing. They're looking at, are you closed off? They're looking at how you answer questions. Certain things may make them snap.
So we'll start out on Monday just doing active listening. On Tuesday, we'll introduce psychosis. Maybe they're hearing voices, they're delusional, whatever it is. And can they effectively de-escalate using the skills that we teach them? Wednesday, we'll introduce suicide, how to do a proper suicide assessment. Thursday, they get a break from the role plays because we'll bring in a community panel. 4 to 6 people with lived experiences that are willing to come forward and say, this is my diagnosis. I've had this run-in with law enforcement. I was addicted to this or that. I'm in treatment, and this is what I would love for you guys to know. But really what it comes down to is I'm a person. And then Friday is test day, and we give them a written test they have to pass, and then we give them a role play test where the time is extended and they have to pass that one. And then we give them a certification saying like, yes, we say that you are, in our opinion, who we would deem ourselves as experts in this field, you are equipped to effectively do this crisis intervention approach on these calls. And the feedback we've gotten from the officers that have already gone through our program here locally has been absolutely incredible for us. I tell people, I'm not just saying this because I'm here, but it has really been one of our favorite groups because they're so hungry for this training. They're so hungry and optimistic about the value of what this training could provide.
But does that tell you also that they recognize there's a serious issue here that needs to be addressed, and those needs weren't necessarily being taken care of?
100%. Yes, I think a big part of the reason why they're so eager for this training is for the reason they've identified the gaps. They know, I'm making these calls, I'm responding to these situations, and then I'm really stuck with what am I supposed to do? And then when I do take someone into treatment, they're quickly released or turned out, and I don't understand why. And they become frustrated with the system, right? And the gaps within the system. And this is a big part of the training as well, is we bring in the local medical examiner's office and we allow these relationships to foster and say, hey, this is why we do things on our end. And now the officers are like, oh, I didn't understand that was the policy, or I didn't understand that's why this happened the way it did. And so then you really start to kind of see it from the other person's lens.
Is this a paradigm shift in the way that we police going forward?
Sure, absolutely. Moving forward, man, I want the rest of these guys to have something that I didn't that would have been so helpful. Thank God there weren't any catastrophic situations, but it certainly would have helped me to understand some things a little bit more.
Any advanced training that we can get these kids, these young officers, to recognize things to make their job better and to better serve these citizens, especially the ones that have mental illness. Hopefully it's going to make a difference to where these encounters with the mentally ill don't always end violently.
We still will do the same training. We will still wear the same gear, but we will have this up here. We will have this here, the ability to think and the ability to speak, and use that to the fullest in hopes of preventing a bad situation.
It's a new way of thinking for us. It's a new way of training for us. It is handling these situations in a totally different fashion than we've been trained to up until this point.
Anything we can do to help calm the patient down helps calm the entire situation down. And that's huge when it comes to mental health. We don't want to excite them to where they become violent.
I think it's such an unfair expectation that communities are placing on the first responders, whether it's police or fire, that just because they wear a badge or just because they went through a police training, that they should somehow show up and know, oh, this is a person suffering from mental illness. I know, I just need to be patient. I need to keep my tone low and slow. I need to empathize with them and be compassionate. That's what I just know how to do when I have zero clue. And so it's about really just learning how to improve. And I think the reason why it's difficult to get buy-in is because you're essentially, you're really talking about changing, which is super uncomfortable, right? And 2020 has really shown everyone this, is that change is very uncomfortable for a lot of people, but typically police departments just kind of, well, we're going to just keep doing the things the way we've always done them. And if you look at policies, so many of police policies are 10 years old, 20 years old, and they haven't updated. And it's just, we're doing the same thing over and over because, well, this is the way it worked.
How many officers have you put through this training so far?
So we've had 40 go through the training, and that's comprised of some the Shreveport Fire Department individuals as well.
We want to roll this out department-wide. Then after it's department-wide with our operations, we want to make sure that every basic training class that comes on from now on receives this training. But it's something that's being developed right now.
And is the idea then to train the entire department?
Ultimately, yes, but we're going to train certain hand-picked officers to then teach the rest of the officers in a classroom setting. So we will have on staff officers that are actually certified in teaching critical incident training.
So the officers on the department and the fire folks are going to present the course to the current cadet class that's in session, while Solution Point Plus watches it or monitors it to make sure that everything is done correctly. And then from that point forward, we will get the blessing to go ahead and push it forward.
They're going to create the agenda, they're going to teach the content, they're going to contact the local partners. We're just going to simply observe and provide feedback. And so we'll do a report of things that went really well, things that they need to improve on, things they could do better, and also act as a liaison if in real time they needed some help with something.
You've gone through the CIT training yourself.
Correct. The crisis intervention training that we received was, in my opinion, the best training I've ever received on the Shreveport Fire Department. And that CIT training, it really taught you a lot. Things I thought I was doing very good at. I thought I had a gift of talking to those people. I found out I wasn't as effective as I could be.
The initial expectation should be that you're going to get officers who are more compassionate. You're going to have officers who are more patient. You're going to have officers that are willing to slow down and realize, like, wait a minute, is there an opportunity here to maybe be creative and think outside the box and maybe not just think, oh, I see a problem, I know a solution is jail.
We've had positive feedback from everybody, folks that have not been through, or hey, when can we get in the next one? This is good stuff, and I have no doubt going forward that it's gonna do positive things.
Police officers and paramedics are not the only ones on the front lines of our mental health crisis. Over the past decade, on both sides of the Red River, emergency rooms have seen a surge in patients suffering severe mental illness. The numbers so great, local ERs are frequently overrun as doctors struggle to find bed space for the mentally ill. Part of the problem, the stigma still attached to mental illnesses like PTSD, bipolar disorder, schizophrenia, even anxiety and depression, leaving thousands of people in our community struggling with little to no help until they land here in the emergency room suffering a psychiatric crisis.
20 years ago, we were seeing 3, maybe 4 or 5 patients a day in the ER with psychiatric emergencies. Now it's 10, 15, 20, 25, 30 per day.
Explain to me, what's a psychiatric emergency?
A psychiatric emergency would be any condition in which the patient becomes overwhelmed to make good decisions. They become disabled by their process.
People would ask me, do you have a couch in the emergency room? And the answer is no. I do very little psychoanalysis or couch work, as they call it. I take care of people who are suicidal, who are intoxicated on drugs, who are gravely disabled because of psychosis or withdrawal from drugs or intoxication on drugs.
How many floors do you have here at the hospital?
We have one floor dedicated to psychiatric patients in addition to a psychiatric crisis unit and then a portion of our ER.
So the 10th floor psychiatric inpatient unit is our current inpatient psychiatry service, and that's where we put patients with severe mental illness. Our criteria for admission there are fairly straightforward. You have to be suicidal, homicidal, or very gravely disabled.
On any given day, how close are you to capacity?
Oh, we're always at capacity. I would say we're at 100% capacity 98% of the time.
What type of mental illnesses are we talking about that you're seeing come into your emergency room most frequently?
So I would say the most common diagnoses would be depression, bipolar disorder, schizophrenia, certainly substance abuse disorders, PTSD, suicidal ideation.
A lot of these people who are out of touch with reality and hearing voices and hearing things and seeing things and acting in a delusional state are definitely a threat to themselves, so they're gravely disabled.
Are emergency rooms really designed to deal with mentally ill patients?
Some emergency rooms are better designed for this than others, although I feel this emergency department has done a good job in that.
But this isn't the ideal place for a person suffering a psychiatric crisis, is it?
That's true, because while the patient is coming in for a psychiatric illness, we are still seeing patients for acute traumas, acute strokes, acute heart attacks, and all the other various complaints that patients come in for. And so at times, I feel that psychiatric patients could be better benefited from a dedicated hospital to take care of their needs.
One of my favorite ways of characterizing where we are right now is putting a Band-Aid on an arterial wound. We simply do not have the resources, especially here in Louisiana, and especially here in Caddo Parish, to deal with the influx of patients.
Do you believe we face a mental health crisis right now in this community?
Yes. I mean, it's pretty clear that we do. The numbers clearly speak for themselves. They've gone up dramatically over the last 10 years, and something needs to be done to fix that problem.
Why has the mental health crisis got at such a critical stage?
My own research on this shows that it's basically repeating cycles of people who, from a broken family, grow up and go through the same cycles of abuse and drug abuse and neglect and broken education and jail and violence. And they have kids that are raised in that same environment, and they grow up and have kids. And so this has been going on now for several generations.
The children see it too, and they feel it. They feel it from an early age, and they carry it from that age all the way forward. Until adulthood. So it's a vicious cycle of distress, and when it goes unaddressed and it goes unchecked, eventually that hurt person will hurt someone else.
It's something that is near and dear to my heart because I see it every day in the ER. And so it's getting younger, it's getting more severe, and it's not going away.
There's a perception that I think if someone's just watching this, they're going to think, the psychiatric patient coming into your ER is probably a homeless person or someone who's chronically suffered substance abuse. Is that who you're seeing, or is there a wide population that you actually see?
There is a very wide population. That could be you, that could be me. A psychiatric illness does not skip over any walk of life. This is just like heart disease. We all are susceptible to it.
And I think that because the symptoms of the illness come out in the behavior, a lot of people put judgment on it. Even families, they love these people, but they think maybe some of this is intentional.
I think that continues to be a tremendous stigma attached to mental illness, and that many do not approach it as a true medical problem, while it is very much so.
I think the stigma of mental illness among people who are working and have functional lives and families and go about their daily lives, I think the stigma is very great and keeps a lot of people from seeking the help they need.
A lot of people's entry into the system is through the police department. A large number of people are picked up and brought in through the police department.
When we're dealing with these people with these mental illnesses, for lack of a better term, they're repeat offenders. We see a lot of the same ones over again, because they can't get the help. We'll commit them to LSU, or their family will commit them to the hospital. They'll get a little bit of treatment, and next thing you know, they're back out.
And so we have many patients who are revolving door patients, I think is what you might characterize them as. Some of them will come back the next day. Some of them will come back in a week, some of them in a year. Many of them we've seen before, once or twice a year, 7 or 8 times a year.
So what happens is John Smith who has schizophrenia and is delusional. He's taken into the hospital and he's admitted into the hospital, and they may keep him for several days and they put him on his medications and everything calms down, and John Smith does very, very well. So what ends up happening is Mr. Smith goes out, doesn't fill his medicines, and in a matter of a few days to a few weeks, he's back into his delusional psychotic state, and somebody picks him up and brings him back in, and it's a revolving door.
How many times during the course of an average week do you think you encounter someone with mental illness or having a psychiatric emergency?
These patrol officers out there now working a 5-day shift, answering maybe 30 or 40 calls per shift. I would say at least a half dozen times during their work week, they're encountering somebody with mental illness.
Most of the time on mental health patients, you're gonna see police and you're gonna see fire at that scene. And that's the thing, law enforcement's not always there when we're dealing with patients. Every call doesn't come in as, hey, this person has mental health issues. It can come in as just a regular medical call, or this person's not acting right. But you know, that's the game of mental health. And it does become frustrating when you're picking that same person up every week.
Are these calls different than others you might be dispatched to?
Sure, certainly. These types of calls can be volatile. The officer has to understand that anything he says, his actions, how he presents himself can be that trigger to send that individual into a bad way. And so it's a very difficult task for officers to show up on scene and have somebody that is acting abnormal, if you will. Because when an officer shows up, you know, we typically have been called when everybody else has thrown their hands up and said, you know what, I'm done. I can't do anything with this. It's yours now.
When someone joins the force and they go to the academy, I don't think they plan to put on that blue uniform and become a social worker or become a street psychologist, but that's part of the reality of the job today, isn't it?
Yes. Over the years, we've inherited a lot of responsibilities that we don't have the means to handle. We don't have the training to handle.
And we are it. When they say first responders, that's for everything. We are first responders for that mental health community also. The problem is we've stepped into that role with minimal training. It's a scary situation, something that you really don't know how it's gonna turn out, and you have to take every precaution as possible with minimal training in mental illnesses.
Is it getting better? Are we being educated? Yes. So no, when you graduate the academy, going out there and deciphering between mental illness and intoxication is not something you're really equipped for.
While more and more of us are becoming aware of what the mental health crisis is doing to our community, we are still a far way away from solving those problems. Perhaps the biggest issue, a severe lack of resources to help the mentally ill. Right now, the demand for inpatient beds, psychiatric care, counseling, and affordable medication far outweigh the supply, leading many professionals to describe our part of the state as a mental health island.
When we talk about a crisis, we're talking about access to care, access to resources. So when you don't have that, we are dealing with a crisis in this area.
I can tell you I've seen the demand grow tremendously. Since 2013, we've seen the number of people contacting us for services go up about 60%.
And in Northwest Louisiana and all of Louisiana, we have increased prevalence of mental illness, one of the highest in the United States. Unfortunately, we have probably the lowest available resources of anyone in the United States.
Behavioral health is unique within a hospital because it's a different set of patients. They are not necessarily medically ill, but they are ill.
A majority of serious mental illnesses are like diabetes, hypertension. They're chronic illnesses, but you're not going to be well in 3 days, and so it takes time to heal.
They require more one-on-one. They require more hands-on. We're talking psychiatrists, we're talking social workers, we're talking recreational therapists, we're talking medical technicians, of course nurses still.
If we had outpatient clinics where you could discharge somebody and say, you have an appointment in the mental health clinic 5 days from now at this time, and if you don't show up, they'll call you and we'll reschedule it and we'll get things done. But the problem is those resources aren't there.
There's simply a shortage of psychiatry and overabundance of patients that need emergency psychiatric help.
We don't have enough providers. There is a lack of social workers and mental health experts, of psychiatrists and nurses and things like that inside of this area.
Why do you think it's so difficult in this part of Louisiana to recruit people to work in the mental health field?
Part of it is the lower pay, particularly for therapists and social workers. If you're choosing a career, looking at making $50,000 a year and you need a master's degree to practice independently, a master's degree and a licensure, they can choose other fields that pay much better than that.
In our community right now, it's not uncommon for people to have to wait a couple of months to get in and see a psychiatrist or a psychologist.
You're absolutely right. There are people in the community who are waiting months and months and months at a time to try to get an appointment.
It's a community problem. It's going to affect everybody here eventually. And I know this is an old phrase and it's a catchphrase, but we have to think outside the box. And because what we're doing is not working.
So unfortunately, when patients come into an emergency department, if they don't have access to outpatient care and management and access to their medications, and they don't know how to obtain those medicines, then they're going to return, and most likely in a much worse situation.
That continuity of care is just not there. Even if somebody cycles through Ochsner all the time, there may be a different psychiatrist coming through each time who's taking a different path to wellness.
So a lot of times people are just left out into limbo and defend for themselves, and their next entry back into the medical community is back in the emergency department again.
And without that type of psychiatric care, without the therapy, without the medicines, what do you think would happen to these folks?
Eventually they would die, either from their addiction, becoming overwhelming, or suicide, or they would end up in jail, which is what happens to a lot of people who are mentally ill. Years ago, they got rid of every mental health long-term facility where people needed years of long-term assistance, and instead of fixing institutionalization, they did away with it completely. Well, there are a handful of people that need long-term institutionalization, and it's not available.
Do you recall what the thought process was behind deinstitutionalization when it comes to mental health?
Get people out of institutions. They thought there was something inhumane about it.
As we deinstitutionalized the psychiatric population back in the 70s, 80s, into the 90s, we started closing down the large psychiatric hospitals or downsizing them because we wanted people to be treated in the community. Well, the idea of putting people in the community is great. But we have to have the services.
In this town, there used to be a lot more mental hospitals and mental clinics and mental health clinics. We have fought for a long period of time to try to get increased funding for mental health. They know the numbers are going up. I just don't think the funds are there.
We're always going to need more. I hope at some point we get there where we have the right amount of available services, but we're not there yet.
For some reason, in this particular state, the first thing we want to cut is education and healthcare. And those are the things where we rank last at nationally. Those are the things that we should be promoting. If you want a healthy and a happy community, you have to invest in it.
How many beds do you all offer here at the hospital?
We have 260 beds. Right now, because of staffing issues, we run about 230. And from that size, it allows us to be very specialized with several different age groups. We'll take children, adolescents, adults, senior care. We have dedicated substance abuse units separate from psychiatric, and then we have the units where they're combined together.
And this is a huge state-of-the-art facility. It will eventually have 89 beds to take care of people, but even that won't fill the demand.
No,
No, I'd be challenged to be completely accurate, but I would say there's hundreds of patients that are in emergency rooms every day of the week and of the month that are being sent out to other facilities out of the city due to our bed capacity. So this is a very positive thing for us to double, if not triple, the amount of bed capacity that Ochsner LSU Health has available to them to be able to provide that care in this community.
How long ago did you get Seedlings up and running?
We started about 5 years ago. We are outpatient services, meaning that we don't have a facility with beds. Beds would mean inpatient. So that means that you come here, you see our doctor, you see our pharmacist, you see our nurses, and you go back to work or you go back and home. Our goal is to get people to live in their community and be as normal as possible.
What is an inpatient hospital when it comes to mental health and behavioral health?
These days, patients are truly the sickest of the sick to get admitted to the hospital. Otherwise, we want to get them into outpatient services. About 50% of the people who approach us are not going to get admitted to Brentwood. But if you are to that level, you're in such a crisis that you have to be hospitalized. It's very short term. We're talking 7 to 10 days now, a person's in the hospital, and our task is really to stabilize the crisis, put a Band-Aid on it, if you will, and to try to instill some coping skills and then get them connected to outpatient therapy services.
So really, when we talk then about people with mental health issues that need inpatient care, these really are people who are sick, very sick.
Right, so we'll be admitting patients that walk in, are dropped off, that we will find in the community, or they'll come to us via emergency room. You'll be in-house, we'll provide services for you, and you'll be monitored by a nurse, therapist, and a physician consistently throughout your stay, and be able to manipulate and manage your needs and challenges to encompass whatever the best protocol or program for you, so you can then restore back to normal health and go about your regular normal lives in an outpatient setting, if you will.
How many folks can you and do you all serve here at Seedlings?
We serve about 350 persons here at Seedlings. I created what we call a one-stop shop for mental health care, meaning that once you walk through our doors, you're supposed to be able to receive all the care that is needed when it pertains to mental health care here, and then you go back in your community and live as abundantly as you can.
William, is there advice that you give to family members who see they have a loved one falling into a mental crisis?
Absolutely. Ask for help, whether that's you contacting an outpatient clinic, whether that's calling one of the national suicide prevention hotlines. Certainly we're here 24 hours a day, 7 days a week. We'll answer calls and provide information, but there's resources all over the country that people can access. Just at least start talking about it to somebody outside the family. Hey, what do I do now?
As the population of people in our community suffering mental illness grows daily, the first responders, health professionals, and experts I spoke with say there is hope for the future. But to overcome this crisis, we must all work together and push our elected leaders to provide more funding for mental health resources and work together to support the first responders, health professionals, and families battling mental illness on the front lines.
Is there hope here? There's a lot of hope here. And I think the potential here is not exhausted. I feel like it's everlasting. But we need to take advantage of what we have here and use it to the best of the ability.
So I think one of the biggest things that we can do as a society is make it so that there is not a stigma and there's not a punishment for seeking help.
They're people that have mental health issues, whatever it be, bipolar, schizophrenia, hallucinations, delusions, whatever the case is, they're still people, and you have to treat them as such.
People need to learn to work with them. There's more people out there that, they need the help, and they're scared to get it because they're going to be judged or something.
The way you policed in 1970 isn't anywhere close to what we do today. Is what we do today correct? Can we make it better? Heck yeah, we can. And we're listening to all those things. We're changing those things.
I want better for the mentally ill. When people call for help for their family, I want, if you have to call 911, there should be somebody trained. When you pick up that phone and say, hey, my schizophrenic son is having a manic episode, I need someone to come calm him down, help him and get him help. That's what it should be. It shouldn't be police pulling up like they're coming to handle a criminal.
So we have to be mentally healthy, and we have to be able to identify officers that may be suffering post-traumatic event disorders, and we need to see about getting those folks help.
There is a huge gap between the haves and the have-nots. People who have access to healthcare and people who don't. That gap is too wide. In this area, we need to figure out how to close it.
I don't think this is something that Brentwood or any outpatient clinic or one of the med-surg hospitals here in Northwest Louisiana is going to solve. I think it requires all of us working together.
It is very common throughout our community and society that we are afraid to seek treatment when we know that we could benefit from it.
We need resources out there for them. And the bottom line is helping that person with mental illness.
The big place that the money needs to be placed is reimbursement for doctors, counselors, social workers, so that they have the resources they need to prevent the recidivism part of it.
It takes funding. It's got to take some public funds. It's got to be state and federal funds to help get more places open. If you could be really aware of who you vote for and how they stand on that, and once they get in office, holding their feet to the fire.
We need more advocacy. It's one thing for those of us in the industry to be advocating. It's something else when parents of children or parents of adults that have mental health and substance abuse get active and start contacting elected officials. They will be listened to much more quickly than those of us who are in the profession.
I want everyone to understand that this is not just a certain part of town's issue. This is a complete issue for an entire city, especially if we're going to ever be a complete city.
Don't judge the person. Find out who the person is first, what's going on in their life. Don't just judge them. You know, all you're doing is hurting the family, and that cuts deep.